Business Unity South Africa CEO Cas Coovadia. Thank you so much and good evening to you. Thank you for your time. Listening to, of course, what has been said just a short while ago, we'll take a step back to 2018 when President Cyril Ramaphosa said that the Presidential Health Compact is an agreement consented to by government and key stakeholders whose work impacts on the health system. Fast forward 2024, there seems to be unhappiness with how this process continues to unfold, and you have some reservations of this current version. What are your reservations?
Hi, thanks for having me. So we were signatories to the first health compact, and we signed it, and we've been working with government on that health compact since then. It was never the intention of the health compact to include something like the National Health Insurance Act. We engaged with government in April this year, as did other stakeholders, on version 2 of the health compact. We made certain comments. We also indicated that we have problems with the NHI in its current form and that we are still engaging on that. And then 2 days before the signing, original signing last week, we get a draft that doesn't include any of the comments we made, and that puts the National Health Insurance Act at the center of the health compact. We felt that under those circumstances, we then wrote to the presidency and said, we are unable to sign this compact because we were not consulted in putting the NHI Act at the center of this. We believe that the NHI Act should be dealt with separately to the health compact. The presidency indicated they will look at our complaints. The launch was postponed. It was then scheduled for today, and we wrote to the presidency asking if we will be contacted to actually engage on this so that we can perhaps get to a health compact that we all agree with. We weren't contacted. So we stand by our position that we don't think that the NHI Act should be at the center of the health compact. We believe that the current health compact has not been properly consulted, and certainly that did not take into account any of our views. And we felt that as a matter of principle, we couldn't sign. We still continue to engage on the NHI Act, and we will continue to engage on the NHI Act because we believe that with some amendments, it can actually put us on the road to universal health coverage. And we are prepared to engage on the compact. I saw the minister said today that given the president's schedule and also the president was ill, that time couldn't be made to engage. Well, if time is made to engage, we will engage. But we hope that through that engagement, we can perhaps then review the health compact.
Do you think there could be a moment where you are able to all, find one another? Because I was listening to one of the organizations that's in full support. They say that, for them, the NHI being in place right now, the compact is a necessary kickstart. That's what they're saying, in order to ensure that this process gets underway. Then you listen to the minister. The minister talks about the fact that they're ready and saying that the compact is ready for implementation. You're raising some serious concerns. You are a big stakeholder. We're also looking at, for example, the South African Medical Association as well, which is also having some reservations. Do you think there could be a way where all of you are able to find one another?
Well, we're prepared to engage to try and find one another, but we're absolutely clear that the NHI Act should not be in the compact. We have serious reservations for the Act. We're not going to sign a compact that sees as one of its role to implement what we think is a flawed NHI Act. So we're more than willing to engage on the compact and see if we can find each other. But our position on the NHI Act still stands.
And there's a lot at stake here, of course, because there is a crisis, for example, in the healthcare sector. You also listen to what the acting president had to say. He talks about the issue of corruption. There's also, of course, the issue of staffing, the issue of mismanagement and all of that, and also the big issue of infrastructure. The gap between the haves and the have-nots has to be closed. And I suppose at some point, it's important for all of you then to be able to speak in one voice in order to close this gap. When it comes to the funding aspect of it, do you think that enough has been done in order to try and address this particular issue?
Funding, well, the funding of the NHI Act, there's no clarity on how government intends funding it.
Yeah.
And that's been one of our problems. We've put forward numerous recommendations to government in our interaction on the NHI Act that can actually get the public and private healthcare sectors working together to address some of the deficiencies in our health system today. We can start doing that today. We don't need the NHI Act for that. We can start doing that today while we talk about the NHI Act. So we don't believe that we need and the president is on record as saying that it will take many years to implement the NHI Act. So you know, we could actually get collaboration between the public and private healthcare sector to alleviate some of the problems in the healthcare sector today. But all the discussion is around the NHI Act. We believe that the NHI Act is flawed. If the government today says, look, let's revisit that, let's see what needs to be changed so that we crowd in the private sector instead of crowding out the private sector, and at the same time, look at what the low-hanging fruit is that we can begin collaborating on today to address some of the problems, we're more than happy to have that discussion.
All right, let's see then what happens if you're all able to have this discussion, because all of you are raising compelling arguments. And I suppose those who are relying on this and ensuring that the gaps are closed are really looking to see if there's a meeting of minds here. But thank you so much for your time. I appreciate it. That was Business Unity South Africa CEO Cas Coovadia.